When we talk about mode of transmission of hepatitis B, we have two main modes of transmission. We have the vertical transmission and horizontal transmission. With the vertical transmission, we are talking about mother-to-child transmission, whereby a hepatitis B positive mother can easily transmit it to the newborn baby. We also have the horizontal one, which has to do with transmission through sharing of sharps, having unprotected sexual intercourse with an infected person. People who go for hemodialysis could be at risk, and so these are some of the mode of transmission that we talk about. There are others mode of transmission, but basically there must be exchanges of body fluids. We've also seen some group of people moving around, very worrying trend. They are moving around with sharps, performing local manicure and pedicure around, and people pay them to get infected. This is not even relating to only hepatitis B, but also other bloodborne infections like HIV. We have about 11 body fluids identified to either contain high levels, moderate levels, or low levels of the hepatitis B virus. Based on these body fluids, one can easily tell how easily you can contract hepatitis B. So we have blood, wound exudate, that is discharges from wounds, and we also have semen. These ones contain very high levels of hepatitis B virus. But before one can get the infection, one thing also plays out: the viral load of the person. Somebody with a higher viral load has a higher rate of infecting others. And when you do your hepatitis B profile, there's something called surface antigen. When you are positive for that one, or what they usually call replicative, you are replicating, your chances of infecting somebody is higher. We also have moderate body fluids, where saliva and vaginal fluid are all part of those body fluids that contains, the moderate levels. We also have very low or non-detectable levels of these body fluids, which has to do with the sweat, urine, feces, breast milk, among others. So these body fluids, it becomes very difficult for one to get hepatitis B virus. And so to some extent, sharing of clothing and also breastfeeding a newborn baby poses minimal or no risk of transmission. Saliva, on the other hand, is moderate, and so one can easily draw a conclusion that sustaining bites from an infected person, especially one who has a higher viral load, could be a medium of infection. Sharing of household items like bowls doesn't pose any risk of getting this B infection. Handshaking, shaking somebody who is hepatitis B positive wouldn't pose any risk. Hugging somebody wouldn't pose any risk. Just a normal kiss on the chin wouldn't pose any risk, unless the kiss results into breakages of the membranes or the lining in your mouth. All these are ways that somebody can easily get hepatitis B. So know this and know that you shouldn't stigmatize against somebody. Shake hands with them, hug them, show them love, and this is the way to go. So we'll move on to our next one, and I hope you joined us that session. Thank you very much.